Dr. Williams, lots of people are very scared about going to a dentist, and let's talk sedation dentistry, which seems to be, a way to literally put a person asleep, but yet don't put him asleep. Time just flies. It's not laughing gas. It's just like a wonderful procedure where people don't feel nothing, no anxiety going on, and can do hours and hours of dental work without even knowing they have been at a dentist. Tell us about it. And you're doing it. Very few dentists are doing it.
Yes, I've been doing sedation dentistry since I started my practice over 17 years ago. It includes either oral sedation, that a patient can take some pills before they come in, or IV sedation. And the difference between the two, with the oral sedation, they'll take either Valium or Ativan that we'll prescribe, which helps them to totally relax. The good thing with the oral sedation is gives them amnesia, so they don't remember the procedure. So any discomfort, any soreness, the patient doesn't remember whatsoever. And that helps them get...
Well, how the heck is he going to ever pay you? If I don't remember that you did something on me, I'm never going to pay you.
When you come before we do the sedation, we collect the fees. So you never pay the day of the procedure. We take care of that beforehand. But when you come in for the procedure, the good thing is we will chat like we're chatting now, and you have no remembrance of either coming into the office. Now, when we do IV sedation, those patients, I don't even want to remember talking to you. We do an IV, and we use various medications through an IV. It's conscious sedation, so it's not like general anesthetic in a hospital where they knock you out and you have a tube down your throat. You're actually still conscious. You can respond. If I say turn right or turn left, you can. Or you can feel physical stimuli. So if I pinch you, you'll feel that. But the good thing with it is you don't remember anything again with the IV sedation. So it helps patients get through long procedures. When I say long procedures, 2, 3, 4 hour procedures that we're performing in the office, where a person's going to get tired of holding their mouth open that length of time. They get agitated, irritable because they're laying there for, 2, 3, 4 hours. You're going to get tired. But when you're sedated, it seems like 2 minutes to you. So that helps the patient be very relaxed, which in turn helps me as the surgeon to be relaxed, and I can flow through the procedure without being interrupted, without the patient saying, well, I got to get up and go to the bathroom, or I need to close my mouth now. I need to take a break.
Well, what about if a patient has to go to the bathroom? I mean, 4 hours is a long thing. Not everybody can hold it that long.
Yeah, exactly. But when you're sedated, that is not a problem, because we have the patients before we start any sedations, oral IV, they use the restroom, and then they come back to the surgical area. And from that point on, that's not even a problem. That's the last thing on their mind. They're just sleeping in la-la land like babies. I tell them that's going to be the best sleep you've had in a long time. And they come back to the office for their follow-up appointment, and they say, you were right.
And yet you can ask them questions. You can say, do this open. You can actually, they're still responding.
Yes, as I said, it's conscious sedation, so it's not like general anesthesia where they can't respond to anything. They can breathe on their own. We don't put any tubes down their throat. They can maintain their own airway, so to speak. So if I say turn right, Mrs. Jones can turn right. Or if I say, okay, be very still, so they can respond to my commands without any problem. That's the beauty with conscious sedation. Right. Unlike general anesthesia.
Right. So, you obviously have figured out the whole treatment plan and talked it over way before. So there's no more ifs or buts. It's you know it all. You know what you're going to go in and do.
Exactly.
Now let me ask you: Are there any you're knocking a person out here in anesthesia. So what are the dangers there? All of us are afraid of anesthesia, of not waking up. Even though very, very little of that happens in a hospital, but it does happen. Or are there any other side effects, like, from other type of drugs? Or is it just are there any side effects or any type of potential dangers? There's something, or does it not work for some people? People who, I don't know.
No. Typically it works for everyone, but for, let's say, a person who's a smoker, they may require just a little more anesthesia than those who do not smoke. But the effect is going to be the same for all individuals. There are side effects. You can get inflammation or infection with an IV anytime you insert something in the arm, but we have not experienced that since I've been practicing in my office. I've heard it. Well, when I did my training, that was one of the complications is, infection at the site where you place the IV, but I've never experienced that with any of my patients. So in my office, we've never had any problems whatsoever, which is good, knock on wood. But we do training, and that keeps us in the forefront of what's going on from the courses we have to take in from our licensures, which actually minimizes and negates any complications for our patients.
Got it. Now, does this sedation dentistry, oral or IV, does that also work for people? There are some people out there who have a hard time getting numb. You inject them Novocaine or whatever it is you use these days, and you inject, and the guy doesn't get numb. Does this one bypass that or not?
No, it doesn't bypass it. It just enhances it. So you have to use less of the anesthetic in terms of getting the patient numb because they're sedated. They're pretty much sleeping, but yet awake. So in the process, you decrease their level of anxiety. And when you decrease the person's level of anxiety, you need less of the anesthetic. So instead of giving them multiple shots, you give them a couple, and they are very satisfied.
So does it help for people who have a hard time getting numb?
Oh, definitely. So yes, without any doubt. If you have a hard time being numb because you're sedated with the anesthetic and with the narcotic, that has central nervous system numbness or effects of it, which in turn releases or causes you to need less of a Novocaine, so to speak.
Okay.
So that person who's hard to get numb, we have no problems getting you numb. You'll be completely comfortable during the process and after the process without any problems.
Okay. And I understand not every dentist is trained to do that. Why is that?
It requires special training beyond regular dental school. When I was in my residency, that was part of our training when we had to do so many hours of IV sedation in the hospital and in my residency as well at the dental school. So anyone just can't go out and say, I'm going to do IV sedation. You have to get the licensure first of all, and once that is obtained, then you have to maintain that certificate by taking special classes and courses every so many years to continue to do the sedation. If you don't, you can no longer do IV sedations.
So it's almost, for lack of better language in my part, almost like an anesthesiologist. You just got to be trained in it, yes. Otherwise you can't do it.
That's correct. You're actually taking courses in anesthesiology, and when you're doing your ongoing training, you're actually taking courses in anesthesiology to maintain your level of competency to continue doing sedations.
Okay. And people like it or not?
I have not met a person yet who did not like sedation.
Got it.
Including myself, because I've been sedated.
Including yourself. All right. Well, thank you very much, Dr. Williams. Bye-bye.
Thank you.